will just be our little short wrap up. You talked about reasons we have to question studies of drugs. And in that paragraph, which is the bottom of page, also you need page numbers, where you're talking about Theodore J. Wittek. Now I forgot what I was going to say. You said there were no studies, but then it seems like you're mentioning a study right here. Maybe not. But that needs clearing up. Okay. Physical therapists or other health professionals value things like health, helpfulness, respect, and reputation. On the other side, on one side of the debate, doctors might be more inclined to prescribe medical cannabis to certain patients certain pain to help them feel better and live more comfortably, as that is what they strive to do with their job. And there's evidence to support the idea that cannabis can relieve pain. On the other hand, cannabis is a recreational drug, and in giving out prescription, health professionals could experience backlash or damage to their reputation due to the fact that the drug doesn't necessarily have a good reputation. I like that. I might even go further to talk. You could talk about why a good reputation is so important for a doctor, as opposed to, some other professionals. I think that's worth exploring. Money could potentially play a role in this controversy with marijuana dispensaries, as well as with big drug companies trying to make profit off medical cannabis. Since in the United States, the use of marijuana is not legal. Throughout, you might consider, I think it'd be good to distinguish between federal, right? So federally, marijuana isn't legal anywhere in the United States. Just to make that clear. Federally, it's always illegal, but state by state, right, it's legal in that bizarre way that, theoretically, something can't be legal in a state that is illegal in the United States, but we keep limping along with this weird situation. Okay, sorry. Since the United States is not legal, this contributes to controversy and it being harder for doctors to portray. Okay. So you do go into that. I would do that way earlier, though. I wouldn't save that till the conclusion, because I think that's an important part of setting the stage and showing your reader that, the important parts of the scope of this discussion. Okay, if marijuana need to be used in a medical setting, there are potential benefits as well as harms. The article's research discussed ways in which the use of medical marijuana would benefit patients, relieve pain symptoms, cause certain disease, also help industry and companies make the product, as well as help to decrease the negative stigmas, use to open doors to other addictive substances, and also result in proven stuff. The values are comfort over security. Using it means some people are more comfortable in this painful life, whereas security about what the drug does. Oh, interesting. I think you're going in a potentially effective direction there. Comfort over security. And I would just say, to wrap this all up, although I also look at your works cited, of course, I think that would be, if you go into that a little bit more, I think that'd be a really nice way to wrap up your paper. That also might help you to have kind of you've done a little bit of having a future focus to wrap up. That's often a good way to wrap up a paper. Especially a scientific paper often will end with implications, sometimes they call that section, or for future study, something like that, where they'll talk about, here's where we need to go. Okay, tiny thing about your works cited. They need to be in alphabetical order. I know that's very petty, but Mr. Ware has to go to the bottom. Okay, I hope that is helpful. I enjoyed your paper.